So my name is Mathew Chow. I'm a child and adolescent psychiatrist. I'm a medical doctor that specializes in treating young people with mental health problems. So anxiety is something that's actually quite natural. It's what protects us from harm and from danger. Anxiety is what causes you to get anxious if you're walking down a dark alley at night. It's what causes you to leap out of danger if you're about to get hit by a car on a busy street. In short, it's something that's natural and it's necessary to protect us. However, anxiety disorders is something entirely different. An anxiety disorder is when that anxiety becomes so overdone, so excessive, that it cripples us. It actually prevents us from doing things that we want to do in our lives. For example, someone with an anxiety disorder might find it impossible to go to school because they're afraid that people might talk about them behind their back or laugh at them. Another example would be some people with anxiety disorders become so afraid of getting into a car that they can't travel to go places. Other people with anxiety disorders might be fearful of contamination with germs, and so they're washing their hands all the time. That's a specific kind of anxiety actually called obsessive-compulsive disorder. Basically, anxiety is when you have this natural phenomenon become excessive, become overdone, and become crippling. So anxiety turns out, or rather anxiety disorders, turns out to be the most common mental health complaint both in children and in adults. And we'd estimate that about 15% of the population is going to have an anxiety disorder at some point in their lifetime, perhaps even higher than that. So anxiety most often leads to children avoiding things. So avoiding school, avoiding going out with friends, avoiding talking to strangers, avoiding crowded places, malls, dances, parties. So these days we treat children with anxiety usually with talking therapy or counseling. And the main goal of that treatment is to stop the avoidant behavior, stop children from avoiding the things that they're anxious about. So for example, if a child is anxious about talking to strangers or going to school, what you would do is help lead them through exercise that gradually help them to start talking to strangers and going back to school as normally. Sometimes children, if they don't respond very well to a talking therapy or talking treatment, or if their anxiety is so severe that it's crippling and they can't even leave the house, we will use medications for those children, but only after a thorough evaluation and after discussing the risks and benefits of medication. Medication does have the potential to quickly bring down a lot of those symptoms and bring psychological and physical relief for children. But unfortunately, if you use medication inappropriately, what happens is that sometimes it can feed into the problem or even counteract talking therapies that are found to be more effective. So anxiety tends to be a long-term problem for people. In fact, in my practice, I find that most people have had anxiety for years before they come and see me, even if they're children. So anxiety is not something that you can just get rid of overnight with a pill or with some type of magic treatment. It is something that is a process that takes time and commitment, but that commitment is worth it. Because what we find is that if people are willing to put in the time and effort to do proper treatment for anxiety, it tends to get a lot better and sometimes go away entirely with any luck. There are many places that children can find help for anxiety. A good place to start is with their school counselor, who often will have some training in basic therapies that can help children with anxiety. A school counselor may also be able to help a child and their parents figure out if something really is an anxiety disorder or if it's just a part of that particular stage in a child's life. Another place to find information is with the family physician. And a family physician often has the tools to evaluate a child to see if an anxiety problem has become an actual illness and requires further intervention. There are also specialists like myself that see children with more severe anxiety problems and can deliver the correct kind of treatment. There's online resources these days. A very good one is the Celtic Mental Health Resource Center. There's also the Anxiety BC website, which has a lot of resources for young people. And in fact, they actually have a specific subsection of their website for youth. There's also a number of other websites online that you can find through Google that talk about anxiety disorders and their specific treatments. Usually websites that are affiliated with a university or a health authority are probably the most reputable for this type of information. So this is a question I get asked a lot. How do you tell if someone has obsessive-compulsive disorder, or OCD, or if it's just something normal, or if it's just part of the personality? So one of the things I usually ask people is, are you afraid that something terrible is going to happen if you don't do the OCD behavior? For example, someone that has true OCD, that's washing their hands a lot, is going to tell you that if they don't wash their hands, something horrible is going to happen. Maybe they're going to get a terrible infection. Maybe they're going to catch cancer. But just some type of terrible calamity is going to happen to them if they don't do that behavior. Other examples would be, if someone walks on cracks on the sidewalk, that they're going to cause an earthquake. Or if they don't cross their legs a certain way, or if they don't eat their food a certain way, they're going to get poisoned, or that someone else in their family is going to get a serious illness. That's usually the kind of fear that comes out of OCD. However, if you talk to someone that does not have OCD, but has these behaviors that you're not really sure of, what they'll often tell you is that, for example, they like to keep things in a nice straight line because it makes them feel more comfortable. They like to put things into order because it makes them feel more comfortable. They like to be organized. They like to make things just right because it makes them feel more comfortable. It's not about an irrational fear of some type of disaster that's going to befall them if they don't actually do that behavior. That is probably the key feature that differentiates what OCD is and what's not OCD, right? Is sort of the irrational fears that come along with OCD. There's also something about persistence. Someone that has OCD is going to persist in their behaviors no matter what you tell them, and in fact, no matter what they try themselves to do to stop those behaviors. Whereas someone that's just a little bit perfectionistic or obsessive, when push comes to shove, they're actually able to interrupt their behaviors or control them to some extent if they try really hard, or in a particular situation where they must have to control those behaviors. I would like to mention that in children, sometimes it's difficult to tell what is OCD and what is not OCD. And the main reason for that is that in adults, individual adults are able to often tell you about their fears, especially if they're irrational, surrounding their OCD and what the nature of their behaviors are. On the other hand, in children, they don't actually understand why they're doing some of the things they're doing, especially if it has something to do with OCD. And so it takes a lot of detective work, actually, not just from a doctor, but often from parents and family members and teachers to figure out whether a child's behaviors are being motivated by OCD or by run-of-the-mill anxiety or something else entirely. So often it takes an entire community, actually, to figure out if someone is experiencing a mental illness. And I would say that would be true for most childhood mental health illnesses, is that it takes a community to not only sort out what the problem is, but also to help the child overcome it.